So welcome and thank you to Dr. Matt Stinson, President and CEO of Jordan Valley Health in Springfield, Missouri. We're continuing our special series on FQHCs. And Jordan Valley Health and Field Trip have been working together to understand the needs of prospective and current patients, employees, and the community in the region. We've done both quantitative attitudinal research, rebranding, messaging, a new fundraising framework. And so Dr. Stinson and Jordan Valley have just been a refreshing and innovative group to work with. And I'm so excited to share some of that inspiration and innovation with everyone today. So Dr. Stinson, I'll just allow you to introduce yourself and then we'll get into questions.
Well, that was a very complimentary introduction, so I'll take it. So my name is Matt Stinson. I am the president and CEO here at Jordan Valley Health in Springfield, Missouri. I've been here at the FQHC now for 18 years, but I've only been in the CEO role for the last year and a half. We're a medium-sized health center with around 67 to 70,000 unique patients, and we have around 230,000 visits per year.
So in our work with FQHCs, and I know Jordan Valley is no exception, there's this feeling of being invisible and misunderstood. So from where you sit, what's the biggest misconception that you see in the community?
Yeah, it comes across in different ways, but it's the similar idea. And that is that if you come to Jordan Valley, you're going to get a substandard of care, or that we're only here to take care of people who have no insurance. And I think that's a very difficult misconception to convey. Like, we've had people in the past who've said things like, are your doctors licensed? Or do your dentists have their license? And it's like, well, they would have to be able to take care of people. But there's this perception versus reality, and that, we have the same standards that other people have. And then they also don't realize the scale, thinking about pharmacy, thinking about dental, thinking about behavioral health, thinking about mobile services, thinking about some of the other things that we do, like surgical services. Like, people don't understand that there's that scale that allows us, when someone comes here, to address about 80% of their clinical needs outside of some specialty care, that we can take care of almost everything here within our buildings or within our walls, in partnership with other organizations.
And, like I said, those are common pain points. But what I found to be, so interesting, and the reason we're working together, is you and the organization really saw that this low awareness and these misconceptions were more than just an annoyance, but it was a real business problem that needed to be addressed. So how did you identify that this kind of common pain point was really a business issue that you needed to solve for, and that is leading to the work that we've done together?
Yeah, I think it's a couple of reasons. And let me just go back for a second and talk a little bit about our patient population. We have always been an organization that has been able to put up a shingle and people have come, like, build it and they will come. And as we've reached the scale that we're at, I think what we haven't done well is we haven't been able to tell our story at all. Like, we don't know what our voice is in the community, because we've just been able to put up a shingle and people have come. And so part of our challenge was, how do we tell our story in a way that is impactful to the past, and also, I'd say, projects forward to the future? And so those questions, like, I don't know that Jordan Valley did that. How do we project out what we do? And then the second thing is, it's for our employees too. Our employees need to have a sense of ownership in what they do. So, we know that more than half of the people that work at Jordan Valley work here because of the mission. And so we want to take that also the mission and be able to project that into the community so people are proud of where they work, which then also affects recruitment. So we want physicians, we want dentists, we want behavioral health specialists to recognize that there's Jordan Valley and they're in Springfield. So when they're coming to our communities, it isn't that they're just looking at the hospitals, but they recognize that there's another healthcare organization that may match with their mission. And I think we realized that people didn't know about us until they came to the community and they were already working at somewhere else. And then we missed an opportunity with them.
Yeah. And that can be such a difficult story to get across. And I know as we did, the research together, what we learned is that sometimes, the more we explain what we do, kind of the more confusing sometimes it can be. And so, you know, barriers to care we tend to think about as transportation, lack of insurance, and those types of things. And another barrier is, a lack of trust. And so building trust came across as one of the themes that's most important. So what are some of the takeaways that you've had in the importance of trust building as both a provider and a leader of the organization?
No, it's a good question. And I think the trust issue is something I think I've known for a while, but I don't think I was like in the front of my brain. I think it was one of those things that I knew was there, but I didn't realize how big of an issue that trust was. So I think as we went through the research and as we went through the rebrand process with you, you all said something that was about trust. And I don't remember exactly what the phrase was, but it was the idea that we build trust. And that's the core. And we ended up having to flip that around a little bit because I think that's when it came front of mind to me to say, no, actually, the way we build trust is we do that through consistent, repeatable showing up for people where they are. And so that means how we meet them at the front when they come in, how we answer the phone calls, how we're here, and when they have a problem and they come in outside of a schedule, are we there for them? So it's predictability and how we follow through, trying to make sure that they see the same provider team if they can. And then just not being judgmental, like starting from the question of we want to understand what you're asking for. We have this this idea of start from yes, and it isn't our slogan. It's really a mindset we want people to come from. Is let's see how we can get to a place where we can solve the problem for them, even if it isn't the way that they think the problem needs to be solved. At least we can show up and not start with a no, come back tomorrow, right? That's not what we don't want to do. And so building trust for us has become a key part that we have realized through the research that we need to do, not only with our patients, but also with our employees. We also want to show up for them and know that they can trust us as an employer to take care of them, not always just financially, but also when they're going through struggles. We want to be able to be there and build a community for them.
Yeah, and just to add a little context of that, I mean, we also learned that, prospective patients and sometimes, the team members are coming into the situation expecting a no or expecting to be disappointed or turned away. And so it's that kind of what can be an opposing situation, but that start from yes is really, a beautiful thing when you can greet that expectation and lower their guard or their nervousness and bring that yes to the forefront. You mentioned, meeting people at the door, and that brings to mind one of the most unique things that I've heard about, and that's rain duty. Can you talk about that and how that's that kind of start from yes mentality come to life?
Yeah, I actually started with my previous boss, Brooks Miller, who was our CEO at the time. I think he started doing rain duty, and rain duty is where, when it's raining, we have a group who goes out with umbrellas and tries to meet people as close to their car as they can and just walks them in. And so I'd say he led by example in doing that. But what really it pushed into is it pushed into all of our people who may not have an interaction with our patients, getting in front of them. So our finance people, our communications team, our even our EVS team, which is our what you would typically consider in the janitor service, right? Making sure that they're there and they are greeting our patients as they come in. It gets our people in front of them. It helps people remember the mission and why they do their job, even if it isn't directly related to patient care. And it demonstrates that, yeah, that we're all in for people because it's so different, right? It catches people off guard and communicates, I think, a message of, hey, we are really here for you. We're not just saying that, we are really here for you.
Yeah, and as we worked with your leadership team, in almost every meeting, I think someone brought forward something. Well, when I was on rain duty, I had this conversation, and I knew that translation was needed, job training, as well as these routine things. And so again, it's that able to experience a little bit of the frontline need with people that are removed.
Mhm.
How has your experience as a longtime provider and still active provider influenced this direction and decision to, reposition the organization?
Well, there's a lot there, but my experience as a physician, I think, has helped me realize a few things. And one of those happened when I was in residency. I had one of my physicians who had a patient in the hospital, and he had had a heart attack, and so it, my faculty physician at the time was saying to me, this patient here has seen the cardiologist, and the cardiologist told him exactly what to do. But he's my patient, he's my primary care doctor. And so when I went in to see him the previous day, he said, Doc, what do you think I should do? He said, I haven't started the medications yet. What do you think I should do? So his question back to me was, who does this doctor or who does this patient trust?
Mm,
Because they didn't take the advice from the cardiologist. They came back to their primary care provider and they asked him, should I do this or not? And they were trusting the doctor. And so I think when you start thinking about, how we show up for our patients, like the relationship that we build with them is the thing that's most important in how we move their care forward and how they want to come here. Because that relationship is what determined whether or not that patient took the medicines from cardiology or not. And it was the right thing to do. We've had people who've come here to Jordan Valley who will use the phrase, my care coordinator. And you think about how that powerful that is, because they're
wow.
not just saying a care coordinator, they're saying that's my care coordinator. And so the relationship that they formed with that individual is deeper than what you would just get with someone who comes in the door. So it doesn't have to be a relationship that's just with the provider. It can be a relationship with the front desk. It can be a relationship with the nurse. It can be a relationship with the care coordinator. And I think, we overlook that so much and we think we want the right answer. Well, really what people want is they want to be cared for. They want to work with a group that trusts them. They want people to talk clearly and simply to them. They want the patient experience to be human.
Mhm.
So we
Mhm.
need to find ways to get there.
Yeah, yeah, definitely. Well, I know that many of the changes and the insights that you've had, every FQHC can benefit from. And many FQHCs think that, well, this is an investment. There's so much uncertainty with changes in federal funding and all these things. It's a time to really kind of constrict and hold on. And you're leaning, just the opposite. And so, what would be your advice to other organizations that are in a similar situation, but just feel that, a bold change like this in terms of rebranding, repositioning, addressing the culture, the programs, it's just not the right time because of the uncertainty?
I think my position on that is that we have to lean into the problems and be the solution. So, for example, Medicaid redetermination, which is coming up, right, through the One Big Beautiful Bill, the Medicaid redetermination is going to go from 12 months to 6 months. Well, that's going to go into place in 27. We don't want to sit back and say, oh, what are they going to do? We want to lean in and say, no, let us help you be a solution to that problem. Work with the state, figure out how we can help with redetermination. Because yes, that serves us on the business side, but yes, it serves our patients on the care side too. Because if we're able to help lean in to solve that problem, then they know that we're the ones that they can trust, right? We can help them on the Medicaid redetermination side. We can help them on the care side. I think the same is there for like work requirements. Those requirements are things that we can help be a solution to. Either A, we can come up with a program that allows them to meet those requirements, or B, we can help those report them to the government. So I think we're trying to be there and say we want to lean into the problems that they're facing and not feel like really that we're the victim of what's going on. We want to be the solution.
Yeah. So if you had, from a marketing and communications perspective, if you could tell other leaders like yourself in this space, like, here's one thing that you could do that would have big impact, where should they start or what should they do?
Okay, so I think it really, if I were going to say one thing, I would say make every patient touch point an opportunity to build trust. And the hard part about that, I think, really is how do you, when you have 800 employees, is how do you get everyone to get behind that? Which I'd say we've been in a transition over the last 6 months to try to get people to that point, and I think we are seeing some momentum. But I think you have to take advantage of every opportunity where the patient is in front of you to build trust, because then they come back, right? And then you get another opportunity, and then they come back and you get another opportunity. So you've got to take advantage of every trust point that you have.
Okay. Is there anything else that you'd like to share with your peers?
I would say, and I know you didn't ask for a compliment, so I'm going to give it to you anyway. I would just say that the reading process, which we've gone through with you all, has helped us on, I'd say, awareness as much as it has on the things you do, like logo and colors and all that. It's just thinking about how, like, what are our patients saying about us and how can we better show up for them in the future. So the process has been more than just about redesigning colors and logo and such. It's also been about how do we help define where we're going for the future.
Well, thank you for that compliment. And that's a beautiful place to end. So thanks for your time. And for more videos and tips on marketing for nonprofits, visit wearefieldtrip.com/nonprofits.